Okay, good evening everyone and welcome to this evening's webinar all about LBT Women's Week and starting a family. Tonight, my name is Emily, I'm from Fertility Network and we'll be joined by Kate, also from Fertility Network, and Natalie Gamble, who is a leading fertility lawyer from NGA Law. So I'll pass over to you, Kate. Thank you.
Thanks so much, Emily, and thanks for joining us, Natalie. It's really lovely to have you with us this evening.
Oh, my pleasure.
The first thing I wanted to ask you as a lawyer is, why is it important for LBT women to be aware of the law before thinking about starting a family?
Well, I think the law kind of often catches you unawares if you've kind of gone into things and, haven't necessarily planned around it. So, for example, it dictates who the parents of a child are and then what rights you have in terms of your connection with that child to pass on nationality and inheritance and make decisions. And if you're in a relationship and you separate, then what kind of court applications you can make. So it's kind of important in terms of the status of your relationship with the child that you're going to have. And that has an impact on other people as well. If you've got known donors, are they going to be parents? Are they not? What can you put on the birth certificate? So there are lots of kind of legal issues around having a family.
So what are the key things that people need to bear in mind from a legal point of view before they start on this path?
So I think one thing is legal parenthood. So making sure that you think and understand, if I conceive a child with the help of someone else, if that's a donor or a co-parent, then, what status is everybody going to have in relation to this child? What can go on the birth certificate? Who are going to be parents and who's not going to be parents? But it's not just that, there are other issues as well. So if you're conceiving through a clinic with a donor, for example, understanding what legal rights that gives the donor and what legal rights eventually that gives your child in terms of the information that they have access to. And that might be something that's really important to them in later life. So kind of the decisions that you're making now before you conceive are going to have a really long tail in terms of their implications, not even just through your child's childhood, but potentially kind of a long way into the future as well. So, it's really important to kind of understand the framework and the setup of the kind of family that you're building and the rules that kind of wrap up your family, if you like, with rights and status and access to information and all those sorts of things.
You were talking earlier about going to a clinic for donor insemination. We know that that can be really expensive, but what do you think are the advantages of doing it that way?
Well, it's very controlled if you go through a clinic, and certainly with a clinic in the UK, all fertility clinics are regulated by the Human Fertilisation and Embryology Authority. So there's a kind of set of rules and a set of laws that are standard to all clinics and all people who conceive through treatment at clinics. So you've kind of got that safety and that guarantee. So you know that donors are screened for kind of health issues and genetic issues. Which means that you've got some safety in terms of your child's health and your health as well, and obviously that's very important. And there's all those legal rules as well in terms of the donor will not be a legal parent of the child if he's registered through a fertility clinic here, and that gives you some protection as a parent with not having to worry that there would be any interference. You also have a whole structure around information rights for your child, that they will have information recorded by the HFEA about who their donor is that they can then access when they're older. So that information is kind of kept safe, if you like. So that, I guess, by going through a clinic, you have access to that whole regulated system.
And what about going to a clinic overseas? Would that be the same kind of thing?
So clinics overseas will be regulated by different rules, and each country will have its own kind of system for regulating them. So in terms of the safety standards and so on, that will be local, but in most countries there is some regulation of medical services, so you could expect something similar. I think what's quite different are the rules around donor information, because the HFEA rules only apply to clinics here in the UK. So if you go overseas and you conceive with an egg donor or a sperm donor at a clinic, maybe in Spain or the US or wherever you go, then that information is not going to be kept on the HFEA register here in the UK for your child. So there may be a different system for keeping information, or there might not be any information that's available. So kind of understanding what differences it's going to make to you if you do choose to go overseas is really important. And I think it can be easy sometimes for parents to look at costs and assume that fertility clinics are all the same, when actually in the longer term it might be a very different experience.
So people need to do their research about the individual country, is that right?
Yes, essentially. And, you know, it's for donation, I keep coming back to this information issues thing, but it is very different in different countries. So here in the UK, the donors are, you know, unless you bring a donor that you already know to a clinic, you won't meet the donors or know their identity at the time you conceive. But the information is kept for your child in the future. So they're what we call identifiable donors. And that's the way the law works. They have to be identifiable donors. In other countries, so for example, in Spain, the donors are anonymous, so that information isn't kept. But if you go to somewhere like the US, you may have a choice. So, you know, the donor gets to choose whether they're anonymous or whether they're identifiable, and there's a mechanism for releasing information later, or whether they may even be completely open donors where you can have their information or even meet them at the outset. So every country has its own way of dealing with things. So understanding how it works in the country you're going to is really important.
Okay. What about finding a donor online? I know there are loads of websites offering all kinds of different ways of finding donors online. I mean, are there things that people need to think about before doing that? What would you advise?
Yeah, and I think you know, sometimes it can be kind of painted as a you know, there's a safe regulated system and a very unsafe online system, but there are some very positive reasons why people choose to find donors online. Sometimes they want to meet the donor and find out more about them before they conceive. Sometimes they want to have that ongoing connection for their child, so that there's kind of continuity, if you like, of knowing who the donor is, and it's not this mystery that gets revealed once the child's older. So there are some very good reasons for finding a donor in that way, but it obviously carries a lot more risk, because you don't have that vetting and screening that you would have if you go through a clinic. So you don't know that the donors, you know, are free of transmissible diseases, that you don't know about their genetics, you know, all of those sorts of things. And there's less legal protection as well. So the donor will, in some circumstances, and I'm sure talk about legal parenthood in a minute, but in some circumstances, the donor will be the legal father. So that carries kind of difficulties for the donor potentially in terms of financial responsibility if, you know, you were to pursue them. But it also carries risk for you, because they may interfere in your parenting in a way that you hadn't anticipated. So I think, you know, if you are looking for a donor where you're choosing yourself and meeting somebody for that purpose, it's really important that you kind of take your time, that you talk through things carefully, that you make sure that you're on the same page in terms of your expectations, and that, you know, the classic scenarios we see where things go wrong are where right from the beginning there was a mismatch between what people expected. And, you know, maybe as a mum, the mum kind of expected the donor to have a kind of a very arm's length role, but perhaps the child would see them occasionally, but from the donor's perspective they were expecting to be much more involved. And because those conversations weren't had in a very open way at the beginning, everybody's gone into it with a mismatch, and then once the child's born, that can create conflict, which can be, you know, really difficult and heartbreaking for everybody.
It's really interesting, actually, because I think I asked that question expecting you to say, oh my goodness, don't ever do it that way. And actually what you're saying is not really that at all, that it can be okay, but what can people do to make it safe, I suppose?
Yeah, I mean, I think, you know, as I said, kind of taking your time and talking through things carefully. You do have the option of finding somebody online and being introduced that way, but then going to a clinic. So you can, it's not kind of a one or other decision necessarily. So you could take the donor to a clinic to go through all that screening and make sure that it's safe from a health perspective. And, you know, so it's not quite as black and white, I think, as sometimes it gets painted.
And what about if you actually have a friend who's willing to donate? Do you take them to the clinic? I mean, what's the best way of doing it in that circumstance?
Yeah, you can do. And again, I think it depends on what the whole setup is and what you intend that donor's role to be. So there's a very kind of broad spectrum of different kinds of known donation arrangements. So at one end of the scale, you might have a donor who is just donating with no intention of any involvement. At the other end of the scale, you might have a co-parent who's going to have kind of 50-50 shared care. And, you know, those are the two extremes, but as you can imagine, there's lots of shades of grey in between those two things. So kind of making sure that, you know, everybody's very, very clear about what they want is really important. So if you're working with a friend, I think it's important not to rush into things. I think sometimes people can get very caught up in the excitement about getting pregnant, and maybe not kind of think about how things are going to work and to plan around it. So we often suggest to people to put things in writing. So having a known donation or a co-parenting agreement, which kind of makes everyone's expectations really clear. And the purpose of a document like that is not so much that you're trying to kind of bind everybody into a legal document. It's more a way of facilitating that conversation. So having to put things in writing kind of helps you have those conversations and to have them clearly. And I, having done these kind of for many years with people, I quite, you know, have had a few occasions where people have come to prepare an agreement, and just in the course of having the discussion about what the agreement should say, it becomes really clear that both sides actually want something quite different. And then sometimes they will decide to walk away and perhaps think, well, no, actually, I'm really looking for a co-parent rather than a woman to donate to. So, you know, this isn't the right match. And I always think when that happens, and obviously, you know, it's not what we expect and not what we want to happen, but when it does happen, I do think actually that's the right thing, because, you know, if they had gone ahead and not kind of flushed out that there was that mismatch between them, it probably would have ended up in a dispute in the family court further down the line. So much better to avoid that than to end up in that territory.
Well, if people do want to have an involved father, would you advise that it's always really important to sort out those parameters first?
Yeah, and it's often not about being really prescriptive about how much time each person's going to spend. It's more about getting the fundamentals and the foundations right. So, you know, do you see yourselves as equal co-parents? Do you see yourselves as a primary parent and a secondary parent? Or do you see yourselves as a parent and somebody who's an important figure but not a parent? And I think getting that sort of structure right, and that kind of then flows into what's everybody going to be called, what are grandparents going to be called, are they going to be involved, you know, how is the time going to be split, how is the decision making going to be managed when there's education, medical decisions. And if you can get that foundation right, everything else flows from that much more easily.
Do you see quite a lot of complications when people have tried to do that themselves without taking advice? I mean, obviously you're sometimes dealing with those cases further down the line.
Yeah, I mean, I think we see either the people at the beginning who are really concerned to do it all really thoroughly and properly and want to talk it all through, or we see the people that haven't done that and then have ended up in difficulty. And it's not that everybody that ends up in difficulty, but it does happen, sadly. And, you know, as I was saying earlier, it's often about those mismatched expectations that were there from the beginning and kind of could have been uncovered with a bit more probing. But sometimes it is about changes of expectations of, you know, people's circumstances changing, people actually wanting more involvement once the child's there. So I think, you know, coming back to this, you know, the positives of kind of working with a friend or finding a donor online, you have to weigh that with the risk that there's another person to manage in your child's life. And, you know, if it all goes really well, then that's brilliant for your child and they're going to have more people to love them and more people to be involved. But if that relationship doesn't go well and there's, you know, dispute or there's tension or arguments, that's going to be a really difficult situation to manage in the long term. So it takes a certain kind of person, I think, to, you know, be flexible and, you know, have that very good quality communication to make it work well.
So talking about, you know, some of the things that you deal with as a lawyer, I think is really interesting. I wonder sort of if you could talk us through us a little bit about what led you to set up your own firm and to start working in this area and what kind of things you actually do.
Oh gosh.
Question.
Yeah. How long have we got? Yeah, I mean, I got into this very much from kind of a personal story of having two children through fertility treatment with my wife, as she now is. But this is, my gosh, my oldest has just turned 18, so this feels like a very long time ago. And at the time, there weren't really any other lawyers who could help with all of these issues around parentage for non-traditional families and those sorts of things. So I started helping other people in a similar situation, and it just kind of grew and grew from there. But we deal with all kinds of families that are being created in different ways, whether through surrogacy, through donation, through co-parenting, adoption too. And, you know, we have a whole team of people that are just so passionate about kind of giving people hope and encouragement and helping them do things in a way that's thoughtful and responsible and ethical and kind of well managed. And I think we believe very fundamentally that, you know, what matters to children is that they're loved. You know, the structure of the family doesn't matter. You know, the gender of the parents doesn't matter. And we want to kind of help families be properly recognised and feel normalised and feel accepted.
So talking about the gender of the parents, can two women be registered as parents on the birth certificate?
Yes, so the law was changed in the UK in 2009, so going back quite a way now, to enable same-sex parents to be registered on the birth certificate together. So the rules depend on your circumstances. So if you're married or you're civil partners, then if you conceive a child through artificial conception, so either IVF or artificial insemination, then you will both be recognised as legal parents, regardless of whether that conception takes place at home or at a clinic either in the UK or overseas. And you can then be both registered on the birth certificate. So the woman who gives birth will be treated as the mother, and then her partner will be treated as the second legal parent. So you're effectively in the same position in law as any other couple that conceives a child together. If you are in a same-sex relationship and you're not married and you're not in a civil partnership, then you can still both be recognised as legal parents, but only if you conceive through a clinic in the UK. And there's a process that you have to follow at the clinic where there's a set of forms that you each have to sign, and that has to be done really precisely. So there's been a whole batch of cases over the last few years where clinics haven't followed that procedure correctly and they haven't given people the right forms, and then that's resulted in parents not being able to be registered on the birth certificate when the child's born, and then the court has had to step in and try and resolve some of those difficulties. So essentially the message is if you're not married, it's a little bit more complicated, so you need to take a bit more care. And also if you're not married, it will make a difference how you choose to conceive. So if you can't both be registered on the birth certificate from the beginning, then there are other ways to remedy that. So the non-birth mother can make an application to adopt the child, so she can become a legal parent, but that's quite a lengthy process. So for most parents, you know, if you can set things up in the right way at the beginning, then you don't have to go through that process.
So basically, if you're not married, the best way to do it, if you want both of you to be on the birth certificate from the start, is to do it through a clinic. If you don't do that, how long does it actually take, and is it an expensive process?
It's not a terribly expensive process and it's not terribly complicated, but it is really long-winded. So you can't apply until the child's 6 months old. You have to notify your local authority and you'll get assigned a social worker who'll come and do a home study and a visits with you and prepare a report. And then you make a court application and the court has to decide whether the order's in the child's best interests. And it invariably is going to be in the child's best interests and everyone's in agreement. But just that kind of going through that whole process can feel quite bureaucratic and it's likely to take around a year. So it's quite a long process compared with doing things at the conception stage that then mean you can just be registered on the birth certificate.
We have actually just had a question for someone which is kind of relevant to this. I'm engaged to my partner, we're about to start IVF abroad. If we were to get married before I have the baby, would that still mean we can both be on the birth certificate, or does that rule apply from conception?
It's conception.
Conception.
Yeah.
Okay, thank you. Answers that very neatly. Thank you.
And then that's a really good question, because it's who the child's legal parents are fixed by what the circumstances are at the date of the embryo transfer or the artificial insemination. So if you get married later or you sign the clinic forms later, it doesn't work. You've got to get it right at the point of conception.
And what about adoption? Is that another option for LBT women? Is that just as straightforward as it is for anyone else?
Yeah, absolutely. So there's no discrimination in the law anymore. So this goes back to 2005. So you can apply as a same-sex couple, you can apply as a single person. And obviously the adoption path is very different to conceiving a child. You would apply to your local authority or an adoption agency to be assessed as an adopter. And you would go through that kind of whole process of, you know, preparation and assessment, which can take around 6 months. And then once you've been approved as an adopter, you will be considered for a match with a child, or a sibling group potentially as well. And so it's a very involved process, and obviously an amazing process for providing homes for children that need those homes. But lots of the children available for adoption are in sibling groups, or they're older. So it's not quite the same experience usually as having a child from birth. So it's a different way of building a family.
And what about for a transgender woman? Would you have needed to have frozen your sperm in advance?
Yeah, so transgender women can conceive children in a range of different ways. And I mean, obviously that you would need somebody else to carry the pregnancy. So if you have a partner who's able to carry a pregnancy, whether they're cisgender or transgender themselves, then you could use your sperm and they could carry the pregnancy. And in those circumstances, as a trans woman, you can be nominated to be the other parent on the birth certificate. Alternatively, if you don't have a partner who's going to carry the pregnancy, you could conceive through surrogacy. And if you're conceiving through surrogacy in the UK at the moment, it's much more straightforward if at least one of the intended parents is a biological parent. So it may be as a trans woman that you've stored your sperm and you're able to use that to conceive a child. It may be if you're in a relationship that your partner's able to provide their eggs or sperm. And the way it works is that the surrogate would carry the child and would give birth, and then she would be registered initially as the mother on the birth certificate. And if the surrogate's married, then her spouse is recorded as the other parent. And then the intended parents, or intended parent if it's a single parent, would make an application to the court for a parental order, and that's an order which makes you the legal parents instead. So at the end of the process, the birth certificate would then be reissued in your names as the parents or the parent. So it's, you know, certainly very, very possible to conceive. But one thing to say importantly in relation to transgender parents is that there isn't any specific law around parental titles for parents who are conceiving children after they've transitioned. So even if you've legally changed your gender with a gender recognition certificate, so you're female for all purposes or male for all purposes, there's some uncertainty at the moment about what parental title you'll be given. So there was a case last year involving a trans man who was legally male but had given birth to a child, and the court ruled that he had to be registered as the mother, even though he identified as the child's father. So the rules around whether you're a mother or a father or a parent don't always follow what you would expect them to. And with a lot of transgender parents, they're conceiving with the help of donors or with the help of surrogates. So it adds another layer of kind of complication on that as well. So, you know, if you're a transgender parent, I guess the message is it's definitely possible to have a family, and you know, whether you can use your own gametes or whether you can't, but it can be quite complicated around the parental titles and making sure that you're a legal parent. So it's good to plan carefully.
Surrogacy is another one of those areas that always sounds really kind of fraught with complications. I mean, what would you advise anyone considering surrogacy to do before they start on that path?
Yeah, I mean, we've seen growing numbers of parents conceiving through surrogacy in the last 10 or 15 years. And I think there's always been a perception that they're very kind of fraught with complication, with kind of the risk of the surrogate changing her mind. That's kind of what the taxi drivers say when you say that you deal with surrogacy law, that kind of thing. But actually, those kinds of problems are incredibly rare. And, you know, we're talking about a tiny handful of cases where that's happened against thousands of successful surrogacies. So, you know, some of the bigger challenges are just navigating the process, you know, finding a surrogate in the first place, which can be quite complicated in the UK because of the way the regulation and the legal framework works. So a lot of parents go overseas instead, and then you end up with children born in different countries, and especially in the last year, all sorts of challenges around travel and getting there and getting the babies home again. So again, I mean, I feel like I keep saying the same thing, but it's all about the planning and the preparation. I think whenever you're building your family in a different way and with the help of other people, you know, if you put that investment in at the start of kind of really understanding how the law works and making sure that if you can, you're making it work to your advantage, you're going to save a lot of heartache and complication further down the line.
And do you think things have improved for LBT women in the years that you've been working in this field?
Oh my goodness, yes, absolutely. And I mean, just again, go back to my experience when we conceived our daughter, and this is back in 2001, it was really hard to find a clinic that would treat patients who weren't in a heterosexual, even married relationship. I remember phoning clinic after clinic and being told, no, we don't do it, which just seems remarkable nowadays. So it has changed massively, and we've seen lots of kind of positive steps forward with the law as well. So, you know, recognising same-sex parents in 2009, I think that was an enormous kind of leap forward, you know, and hopefully things are going to continue getting better. We've got the Law Commission looking at surrogacy law reform at the moment, which will hopefully kind of make things easier and more straightforward for surrogacy. And I think, you know, all of that legal change has come kind of hand in hand with changes in attitudes that, you know, families of all different shapes and sizes are recognised so much more broadly now than I think they were 15 or 20 years ago. I mean, you see, you know, Sainsbury's adverts and, you know, programs on kids telly where you're seeing two dads or two mums or, you know, mixed race families, whatever it is. I think there's much more acceptance that, you know, families are just kind of built by the connections and the relationships, and actually the structure is much less important.
I must say that's actually quite shocking to think that it wasn't really that long ago and that clinics were saying that. But are there any areas that you still think should change and that you'd like to see change in the future?
Yeah, definitely. So, I mean, we've been campaigning for a very long time for surrogacy law reform, and that's kind of very much now on the map. So the Law Commission is in the middle of a 3-year project to improve the law. And surrogacy law was kind of written in the 1980s, so it's very long overdue for an update. I think we would also like to see changes to recognition of multi-parent families. So, you know, families where, you know, mums are conceiving with dads together and perhaps the child has 3 or 4 parents, you know, to be able to recognise more than 2 parents on a birth certificate where that is the child's reality, that's really important. And then also, you know, we talked a little bit a minute ago about transgender parents and the fact that there isn't really any law catering for what happens where a transgender person conceives a child after transitioning, from a legal perspective. And, you know, I think that's really important and something that we need to see. So there's lots done, but lots more still to do.
And I'm sure you'll be at the heart of doing it, Natalie, too. Thank you so much for joining us this evening. It's been really lovely to talk to you, and you've just been an absolute mine of information. So thank you for joining us for this webinar for LBT Women's Health Week this evening. It's been really great, so thanks.
Oh, it's a pleasure. Thanks for asking me.
Thank you so much, Natalie and Kate as well, for your time this evening, and thank you to everyone who's joined us. So this recording will be available on our YouTube channel. You can find that via our website or social media, hopefully by the end of tomorrow, so just keep an eye out for that. And yeah, I think this is really informative. Hopefully it'll be a good practical, almost like a handbook you can refer back to if you need any help in the future. If you would like any support, do consider our support line or our support groups. We have support groups all over the nation. We also have a specific same-sex support group. If you'd like to learn more about that, I think Kate would be the best to email, so you can reach her at kate@fertilitynetworkuk.org. So thank you so much for joining us. Hope everyone has a good evening.